Hello, are you my 3 o'clock? Come on in. You can get settled on the examination table. So I am Dr. Sandbox and I'll be treating you today. I'm just going to get my mask on and my gloves on and then we'll get started. Okay, strap over my head. Okay, got my mask on. And now I'm going to put on my purple gloves. So, why don't you go ahead and give me some basic information. Let me make sure I have your name correctly. Can you spell it for me? Yeah, okay, let me just type that on my computer. Yeah, I love that name. It's beautiful. Okay, and your date of birth? Okay, that's already correct. Wonderful. So, what is it that brings you into my clinic today? Oh, I'm so sorry to hear that. Headaches can be so uncomfortable. Alright, well, we're going to take good care of you today. I'd like to know a little bit more about your headache. When did you notice it starting? Okay. Is there anything that makes it worse or better? Okay, yeah, that's pretty typical. Gotcha. Okay, yeah. And how much would you say it's affecting your life on a scale from 1 to 10? Okay, a 6. Yeah, that is significant. Anything else you want me to know about where the headache is located or what it feels like? Yeah, I really like that description. I mean, I don't like that you're experiencing the headache, but that's a really helpful way to describe it. Alright, well, I want to do a few tests just so we can try to get to the bottom of what is causing these worsening headaches. I'd like to start with a special nasal swab test, and with just this one cotton swab, we can actually test for 7 different viral infections. So, I want you to just relax your neck, relax your shoulders, and I'm going to circle this cotton swab in each nostril 5 times, okay? I'm not going to push very deep or very hard. You ready? Yes, absolutely. Okay, we'll go slow. Ready? 1, 2, 3, 4, 5. Good. Yeah, just take a deep breath. You got this. Okay, next nostril. 1, 2, 3, 4, and 5. Alright, I'm going to pass this off to my nurse, and he's going to get that in the testing machine. Okay, so we're going to find out if you have any viral infections, but let's also just make sure that your eyes are working correctly, because sometimes eye problems can lead to headaches. Okay, first I want you to look at this, the tip of this blue pencil, and just follow it with your eyes. Very good. Now notice when it disappears. Okay, good. And now when it disappears on this side, and good. Alright. Now I want to take a look in your actual eyeballs. So first I'm going to have you look up. Yes. Okay, and now look to this side. Good, now this side. Good, and now down. Okay, your eyes are looking okay to me. Does the light feel extra bothersome? Yeah, okay. That's good to know. Let's try this side. How does the light feel? Okay. Okay, well, thank you for telling me. Okay, next I want you to move your neck around for me. Tilt your head from side to side. Very good. Now tip it down, tip it back. Okay, good. I'm just going to feel the side of your neck, if that's okay. Okay. And this side. Yeah, I can feel a little bit of tension. Is that more tension than you normally have in your neck? Okay. Well, that could be a contributing factor. Oh, my nurse is back. Thank you so much. Okay, I have the results, and negative, negative. All right, all 7 tests were negative. So it looks like you don't have any viral infections, so that's a really good sign. I know you're still dealing with these headaches, so let's see if we can do a few things right now. First, I want to have you do some belly breathing. So instead of breathing into your chest, I want you to breathe into your belly. Okay, go ahead and try that for me. Very good. Okay, next we have this special new technology. It's Bluetooth enhanced cold packs for your head. You can see there's this little hole here for your nose, and we can just put this right over your head, and the gentle coolness can help provide some relief. Do you want to try it on now? Okay, yeah, let's just put that on you for a minute. Ready? Here we go. Okay, now how do you feel? Okay, I want to ask you a few more questions. Have you been dealing with any additional life stressors recently? Okay, I'm just going to write this down. And how's your social support? Like your friendships, family, how are those relationships? Okay. I see. Okay, and how have you been sleeping? Okay. You know, moving to a new house or a new city, like that can be such a huge transition, and it's possible that that is one of the driving factors behind your worsening headaches. What do you think about that? Okay, I have a suggested treatment plan for you, and I'd love to see you back in about a week, unless things get worse, and then I want you to come in as soon as possible. Okay, so I'm going to send this special ice pack home with you, and try to use this 3 times a day for 10 minutes at a time, if possible. Now, if you only have time to use it twice a day, that is okay too. Okay, yeah, this is for you to keep. So, ice pack 2 or 3 times a day. I'm going to write all this down for you, but I'm just going to explain it first. Okay, and then we have this Tiger Balm. Have you ever tried Tiger Balm? It can feel really nice on sore muscles, so this is something you can use topically on your neck or on your the sides of your head, and this can just provide a little bit of temporary relief. Yeah, okay, so we'll put that aside for you. Do you prefer taking Tylenol or ibuprofen? Yeah, just whatever you normally take, feel free to take that according to the directions on the bottle. And if in a week you're still having pain, we can move on to a prescription medication. Yeah, okay, so you've moved to a new place, and I'm a medical doctor. I'm not a mental health therapist, but I can tell you that there is significant medical scientific evidence that having a good social support structure is really beneficial for health and for pain relief. So I know that it takes time to adjust to a new place, it takes time to meet new people, but I just want to gently encourage you to get out there, maybe say hi to your neighbors, maybe find a church or a club to go to, and keep in contact with your friends and family from where you used to live. Yeah, it's absolutely worth it. Yeah, social connection is so important. Okay, it sounds like your sleep is really troubling you, so I would like to write you a prescription for that. This is something you can take as needed. You don't have to take it every night, but it's an option for you, because if we can get you sleeping better, then I'm wondering if your stress and your headache will improve. Okay, I'm going to write this down. Okay, 50 milligrams up to once daily. And I'm going to write both the name brand as well as the generic, whatever your pharmacy has, whatever your insurance will cover. And this should be enough for 30 days. And I'm not going to give you a refill for now because I'll see you again in a week and we can go over then if we want to continue on this medication. Okay, so I just need to sign this. Very good. Okay, I'm going to hand this to you. You can just take this to your pharmacy, get that prescription filled, see if that helps with your sleep. Remember, you can take over-the-counter pain medication and use this head cooling device and this Tiger Balm for pain. Are you up for hearing one more suggestion? Okay, great. So we have some mental health therapists that we refer to. We refer some of our patients to, and they use a type of therapy called dialectical behavioral therapy, or DBT. And it's something that I've really benefited from myself. And if that is, if your stress continues to be high and your pain continues to be ongoing, DBT can be a helpful way to both manage stress and pain, and also like deal with it in a productive, constructive, and accepting way. Yeah, I just wanted to let you know that's an option. We can absolutely talk about it more another time. Okay, well, are there any other questions you have for me? Breakfasts. Yeah, I'd recommend something high protein, something with a lot of good micronutrients. Yeah, that sounds good. Just keep eating that. Any other questions? Yes, my receptionist will give you a business card on your way out, and that way you can easily give us a call if you have any questions or if you need to come in again before next week. Thank you so much for coming to see us. I'm Dr. Sandbox, and it's so nice to meet you. We want you to feel cared for and at home in this new city of yours, and I hope you'll come back to see us soon, but I also hope that you feel better soon. Yeah, it's so nice to meet you. I'll shake your hand, and I look forward to seeing you again soon. Thanks for stopping by. Bye for now.